What I love about this job is the variety, and no day is the same, and that's great, because I deliberately haven't specialised. I know some people specialise. I deliberately haven't specialised in sort of 25 years because I would like to keep the breadth and scope of patients I see very broad. But thinking about an average day, well, you know, I do treat babies, but I don't see an awful lot of babies, and sometimes there may be issues with sort of the way they've been born, and their sort of heads are a little bit tilted, and they're finding that there's a slight bias. So some very, very gentle. We don't do anything. You know, with babies, it's all very subtle, very gentle, just working with the tissues, and that's a great thing about osteopathy. You're becoming familiar with what you can actually do, how compliant muscles are, how, you know, joints are. And that's not just with babies, but especially as you get older, you get to know the quality of joints, you know, degenerative joints, what it feels like, joints that are being compressed, that become very restricted. And that's the sort of thing you may look to work on. So I've treated, for instance, today I saw people with degenerative cervical spines. They're getting sort of neck pain, general pain around there, because of age-related conditions, and because of the work that they're doing. I've seen an awful lot of teenagers lately, so with tendinopathies, problems because they're playing too much sport. Again, maybe neck pain. I'm seeing an awful lot of people because they're sitting at desks incorrectly and posture isn't great. And as far as treatment's concerned, you know, it says we do massage on the sort of publications and everything, but working with muscles is very different. You know, there's tight, there's fibrotic muscles, there's tense muscles, and muscles have kind of different statuses or different conditions that they're in, and treatments will be different. You don't just massage it. You can do gentle inhibition and trigger point. Some need stretching, some need what are called muscle energy techniques, MET techniques, where you actually activate the muscle to take advantage of the relaxation. And if joints are stiff, we mobilize them. We call it mobilization or articulation, where joints are bathed in synovial fluid. So you're looking at you can't oil a joint, so you look to sort of mobilize it gently, and you get the soft tissue around that to sort of relax off, looking to restore improvement and restore mobility to areas so people can function better.